Learners, we have discussed in the preceding part of this module the physiological role of macro minerals and some of the trace elements. We shall now take up the rest of the trace elements, that is manganese, iodine and fluorine, and deal with their significant functions in the body and their associated health benefits. Manganese, besides its important role in metabolism, is responsible in scavenging the reactive oxygen species. Iodine, as a component of thyroid hormone, functions in the body's metabolic rate. Fluorine is regarded as a double-edged sword. It prevents tooth decay, but then at the same time excess intake for a prolonged period leads to staining and pitting of teeth and skeletal fluorosis, which is a crippling disease seen in endemic fluorosis areas. Let us now see, learners, the potential benefits of these micro elements if and only when provided adequately in the diets to perform varied functions in the body. Now, coming to the first one, manganese. Manganese is a component of activator of some enzymes, mostly antioxidants, and plays an important role in metabolism of carbohydrate and lipids, even in maintaining the normalization of the synthesis and secretion of insulin as well. Therefore, manganese may have protective effects on the occurrence of metabolic syndrome. In addition, manganese is one of the required components for manganese superoxide dismutase, that is mainly responsible for scavenging the reactive oxygen species in mitochondrial oxidative stress. Both manganese deficiency and intoxication are associated with adverse metabolic and neuropsychiatric effects. Now, coming to the health benefits as related to type 2 diabetes mellitus, several pathogenic pathways activated in diabetes, such as reactive oxygen species generated by high glucose levels, are responsible for metabolic abnormalities and chronic complications. Oxidative stress can result in impaired islet beta cell function, cause insulin resistance, and finally lead to type 2 diabetes mellitus and obesity. Now, recent studies using transgenic mice that overexpress manganese superoxide dismutase enzyme showed protection against diabetic complications, for example, diabetic cardiomyopathy, retinopathy and neuropathy. Moving on to the next benefit of manganese as related to obesity. Obesity, as we all know, has become an increasingly prevalent metabolic disease that is associated with increased risk of developing type 2 diabetes mellitus, cardiovascular disease and non-alcoholic fatty liver disease. Oxidative stress and production of reactive oxygen species have been linked to the development of insulin resistance, type 2 diabetes mellitus and obesity, suggesting a potential role for reactive oxygen species in the pathogenesis of these disorders. Antioxidants such as superoxide dismutase exert beneficial effects in metabolic diseases associated with obesity as well as in type 2 diabetes mellitus. Let us now see the role of manganese in atherosclerosis. Atherosclerosis is a chronic inflammatory disease of the blood vessel wall. Oxidized low density lipoprotein and endothelium dysfunction play a key role in the pathogenesis of atherosclerosis. Manganese superoxide dismutase was reported to reduce the oxidized low density lipoprotein induced apoptosis of macrophages, protect against endothelial dysfunction and inhibit oxidation of low density lipoprotein by the endothelial cells, thereby offering a protection in atherosclerosis. Now coming to the next one, the non-alcoholic fatty liver disease. This disease is characterized by excess triglyceride accumulation in the absence of excessive alcohol intake and is the most common chronic liver disease that is associated with metabolic syndrome, obesity and type 2 diabetes mellitus. This disease can progress to inflammatory non-alcoholic steatohepatitis, that is NASH, fibrosis, cirrhosis and end-stage liver injury in humans. Rat histopathological observations suggest that superoxide dismutase may help in prevention and treatment of this liver disease in humans, that is the non-alcoholic liver disease. Now coming to the next trace element, that is iodine. Iodine is an essential element in the human diet and a deficiency can lead to a number of health outcomes collectively termed as iodine deficiency disorders. The thyroid gland needs iodine to synthesize thyroid hormones, that is thyroxine T4 and triiodothyronine, that is T3. Insufficient iodine results in overwork of the thyroid gland, which leads to its enlargement, and the condition is known as goiter. In infants and children, these hormones are necessary for normal growth and development, both physically as well as mentally. Very severe hypothyroidism in the womb and in infancy leads to cretinism, which is a dwarfed and mentally retarded state that quickly becomes permanent. The thyroid hormones regulate the metabolic rate as well as energy production in the body. Now, as related to cardiovascular diseases, the body needs adequate stores of iodine for the heart to beat smoothly and for a stable rhythmic heartbeat. Iodine as well as omega 3 fats is critical to the stabilization of the electrical impulses of the heart. Lack of iodine is related to atrial fibrillation. Iodine directly or indirectly can normalize serum cholesterol levels as well as normalize blood pressure. Role of iodine with respect to the insulin receptors. Iodine is known to attach to insulin receptors and thereby improve the metabolism of glucose. It appears that iodine increases the sensitivity of insulin receptor, which improves glucose control. Lower amounts of insulin are needed to keep the blood glucose levels in the normal range. More research is needed in this area to confirm and expand these results. In the same way that iodine modifies insulin receptors, it is possible for iodine to modify other receptors as well in the human body. This is yet an unexplored area of research. Now, role or benefits of iodine as related to bones. Iodine and fluoride both are halides. So, they share some chemistry, but then they have very opposing effects in the body. Fluoride is toxic to bones as well as to the central nervous system, while iodine nourishes both. Very little research has been done in the area of iodine sufficiency and bone strength, but these ideas need to be evaluated clinically as well as in research studies. Now, role of iodine as related to lungs. Iodine goes to the sites of inflammation or infections, including pulmonary or bronchial infections. Using iodine for chronic obstructive pulmonary disease has been recommended as it helps loosen up the secretion and makes them easier to expel. It also helps prevent bacteria from growing in the mucus secretion. Then iodine as related to immune system. Iodine plays a role in the immune system. Bacterial infections cause an increase in the metabolism of the thyroid hormone thyroxine. Experiments have shown that leukocytes use iodide just as well as thyroxine as a source of halogens for destroying the engulfed bacteria. Sufficient iodine present in the body to fight infections will improve a person's overall health as well as resistance to diseases. Then coming to the next benefit of iodine as related to central nervous system. Iodine is essential for the development of the central nervous system. Women need a good supply of iodine before becoming pregnant. Infants in particular are vulnerable, especially in the womb, to iodine deficiency. The infant's brain requires iodine for proper development. There is a whole continuum of effects from mild mental retardation to a gross neurological impairment in iodine deficiency. A big effect of iodine deficiency is reflected in infant mortality also, as shown by several research studies. Now, coming to the last trace mineral or microelement, that is fluorine. Fluoride is the iron form of fluorine. The primary role of fluoride is to prevent dental caries. Ingestion of excess fluoride, most commonly through drinking water, can cause fluorosis, which affects both the teeth as well as the bones. The dental effects of fluorosis develop much earlier than the skeletal effects in people exposed to a large amount of fluoride in endemic areas. Clinically, dental fluorosis is characterized by staining and pitting of the teeth. Chronic high level exposure to fluoride can lead to skeletal fluorosis. In skeletal fluorosis, fluoride accumulates in the bone progressively over many years. The early symptoms of skeletal fluorosis include stiffness and pain. The bone structure may change and ligaments may calcify, with resulting impairment of muscles and pain. Skeletal fluorosis is known as a crippling disease also. Acute high level exposure to fluoride causes immediate effects of abdominal pain, excessive saliva, nausea and vomiting. Seizures and muscle spasms may also occur. The control of drinking water quality is therefore critical in preventing fluorosis. Now, coming to the health benefits of fluorine as related to dental caries. Fluoridation of drinking water aids in preventing dental caries and tooth decay. This is the known health benefit of fluorides. Now, learners, we have come to the end of this module on non-nutrient effects of specific nutrients as related to minerals. From the foregoing discussion, it is clear that minerals play pivotal role in the human body. Each mineral has a specific physiological role by virtue of which it performs significant functions. Research studies highlight the innumerable benefits of each of the macro and micro minerals in non-communicable diseases, which includes Alzheimer's, stroke, heart disease, diabetes, cancer, Parkinson's disease, etc. It is important that the potential mechanisms involved in alleviating the disease state be explored further and that the specific action are identified at both the molecular and the genetic levels. Until these mechanistic modes of actions are identified, the efficacy and its therapeutic importance will remain the prerogative of only researchers and scientists.